Asthma, as I've said earlier, is an inflammatory chronic condition of the airways in the lung, which causes narrowing of the airways. And because of the narrowing of the airways, the air going through the airways is through a very tight space. So people get a whistling noise called wheezing. They get shortness of breath. They get cough. Along with the cough, they can also have chest tightness. So these are kind of common symptoms. Along with that, we sometimes feel that there are triggers which causes the problem. The trigger could be a viral infection, it could be dusty environment, it could be high pollen count, as it happens in summer season. That people find that the pollen count is high and that causes their hay fever and asthma symptoms quite bad. Along with that, there could be other triggers as well. Sometimes people are allergic to cats or animals in the house, and some people get it in their workplace through their occupation, exposed to chemicals and various things. So asthma can be genetic or could be environmental, and a combination of the two could cause the problem as well. So there are various things as clinicians we use and corroborative evidence to like put jigsaw pieces of a puzzle together to see the picture. So we ask the patient to maintain a peak flow meter diary card at home, measuring their peak flow, which is blowing into a machine and recording it in the morning and evening recordings every day. Along with that, we give them a steroid inhaler trial and see how their peak flow meter variability is and how the inhaler is helping. So that's a very basic test we can do. Apart from that, we've talked about exhaled nitric oxide measuring, which we can do in a bedside test or in the office space for diagnosing asthma. It's a helpful tool which helps give more evidence that this condition that the patient is suffering is asthma. Now, the symptoms and the history is very, very important in asthma patients because the history of moving from one room, which is a hot room, to a cold room causes the symptoms. Having food sometimes brings it up. Going into an open field or a garden brings it up, probably pollen-related effect. Or they could be in an environment there are pets like cats, which could bring the symptoms up. So I think a good corroborative history of asthma with symptoms in there, and then these tests. So we talked about peak flow meter charting, we talked about exhaled nitric oxide test. The other test we could do is a blood test, which is blood eosinophil count, immunoglobulin E, which is again another blood test. And along with that, we also do a chest x-ray to make sure there's nothing else, because chest x-ray has to be clear. If chest x-ray is showing some abnormality, then obviously we worry about other conditions which could cause similar things to asthma. Along with that, we arrange spirometry with reversibility assessment that's done through a lab. It's not done in the clinic. And sometimes we do challenge people with certain things that they could be allergic to and see if the airways become narrow. So we do challenge testing as well. Asthma, as I've explained earlier, is a chronic condition of the airways. So at times people can have good days and people can have bad days. But in modern day and age, there's no excuse of not having a good control over this condition. So we have various agents we can use, especially the inhaled corticosteroids have a very good effect on controlling symptoms of asthma. Sometimes, as I said earlier, there could be mild, moderate or severe type of asthma to make it simpler. And depending on the severity of asthma, we step up treatment or step down treatment if the control is good. So sometimes initial treatment is usually an inhaled corticosteroid, but that is stepped up to another level where we combine an inhaler which has a long-acting bronchodilator therapy along with an inhaled corticosteroids. And that's kind of a step 3 treatment in asthma management. And symptoms usually are well controlled. Sometimes we add in leukotriene inhibitor tablet called Montelukast, 10 milligrams we usually use at night time. And that will help control exercise-related symptoms next morning. We sometimes add another tablet called Unifilen. And Unifilen is an aminofilen group of tablet, and that again helps control, and it's used twice a day to control the asthma symptoms. And again, if this treatment sometimes do not work, we have to give steroid courses as well, because some asthmatics are steroid dependent as well. There are some newer drugs available as well, which can be used. These are biological agents. There's also modern bronchoscopic treatment called thermoplasty now available for asthma management. So there is various ways we can help asthma patients up, but I think the most important thing is asthma management care plan. And today's day and age, every patient should have a care plan like this, which tells them that what treatment they are on, what is their peak flow, and if the peak flow is drifting down, then what does it mean? It certainly means that their asthma control is not good. One other thing is if people are getting nighttime symptoms, especially nighttime coughing, then that's a sign that their asthma is not well controlled. They have to go and see their chest physician or the GP about it or asthma nurse about it. And this is very important to get it right. So asthma care plan is very important. Some contact with the primary care about your asthma, you can ask people to help is very important. And again, to identify when somebody is developing an infection. If somebody is developing an infection, the cough, the sputum changes color, consistency and amount, and that's the time you need to see a doctor.